Hi, I'm Darla at Inspirations Med Spa. We are going to be doing a Botox injection here. Botox is used to relax muscles that are caused by movement. So what we will be doing is, raise your forehead for me, raise up your eyebrows. She has these lines across her forehead here. So we'll be treating those to relax those. And when we relax the forehead, it actually kind of opens things up here. Make a mean face for me. She also has these lines in here, and it kind of bunches up in here, and she gets the bunny line here. We're going to be relaxing those muscles also, and that pulls up this direction also. She does, you can see her lines some when she's at rest. Those are called static lines, but it's really the dynamic lines for when she moves that we treat with the Botox. Another area that we are going to treat is her crow's feet area. Smile big for me. You can see when she smiles, most of her lines are in the lower part of her eye here. So this is where we will treat her. We're also going to treat this little muscle that comes down here. It's called the DAO, and that pulls down on the corners of the mouth. So when we relax that muscle, it allows the corners of the mouth to come up. We're gonna inject her mentalis muscle here, which also kind of pulls up, causes this line, and it also causes kind of an orange peel, dimply look to your chin. So we're gonna inject that, and that will relax that. Are you ready?
I am.
Okay. So Botox takes about 2 to 3 days to take effect, and it will generally last about 3 to 4 months. So I'm gonna start here in the center, and I like to just pinch a little bit because it takes away some of the discomfort from it. And inject just very slowly. Go ahead and make that face for me again.
Which
the mean
one?
face. Just gotta let me. Okay, and then relax. So we're gonna go into this one. And do that for me one more time. Okay, and relax. Okay, once more for me. And we're gonna go right into the end of this muscle, okay? Relax. And one more time. And relax. Okay. And now we're gonna go up into the frontalis muscle, which is the muscle that works on the forehead here. Go ahead and raise your eyebrows up. That. We do not inject in the lines. We inject in the muscle that, you know, kind of bumps up in between the lines. We don't have to inject very deep here. If we inject too low on the forehead, it will cause the brow to actually drop instead of coming up like we want it to. Okay, relax. Okay, so that will relax these lines in here and all the lines across her forehead, and it will give her a little bit of a lift to her brow. Now I am going to inject, this is actually for down here. So pull down on the corners of your mouth again, like you're, there you go.
This one?
So you see how that pulls? We're gonna inject that area and poke. And then, okay, you can go ahead and relax. And then you can see she also pulled up on her chin when she did that. So we're going to give her 2 injections right into her chin here. Okay, and then now we're going to move up to her crow's feet. Okay. So smile for me like that again. Now the crow's feet, we really inject just, okay, you can relax. Very superficially. Make a little bleb, because the muscle is actually not very deep under the skin here, so we don't have to go very deep. And then I'm going to actually walk around to do this side and smile for me again. Okay, you can see her bottom one is right here, so we're going to come just barely into that. Again here. And last one up further. This one up here will really pull that out. How was that for you?
Not bad.
Yeah. I use a very small needle, so there's really very little discomfort with this. In about 2 to 3 days, she'll start to see the effects. Full effect is usually at about 2 weeks. I see her back at the 2 weeks since this is her first injection, and at that time we can do any touch-up that she may need. I may do touch-ups maybe about 20% of the time, especially in somebody who's new, because it takes a little while to get used to their muscles and how their muscles work. So we will see you back in 2 weeks.
Okay.
Okay.